So if we're at 1% or 2% GDP growth now, that feels a little bit more comfortable and a little bit more real.
Is how do you take the waste out of the ecosystem, the business ecology, so that you can be more competitive in terms of your offerings to people?
Doing what you call both an epidemiologic transition and a demographic transition. Epidemic transition because in many countries in the world you go from a burden of disease that's primarily driven by infections.
Good morning, everyone. Ladies and gentlemen, sponsors, members of the press, welcome to the 2018 CEO Policymaker Interactive Series organized by WIMBIZ. My name is Olubunmi Aboderi Talami and I am the chairperson of the WIMBIZ Executive Council. Welcome once again. I bring you greetings on behalf of the WIMBIZ trustees, the Executive Council, our associates, and our fellows, the Windward Fellows. Thank you ever so much for being here. Please give a round of applause to the person sitting next to you. Thank you for coming. WIMBIZ was formed in 2001 by 14 individuals desirous of creating a non-profit organization that would be the catalyst which elevates the status and influence of women and their contribution to nation building. Our mission is to inspire and empower women to attain leadership positions in business, management, and public service. We collaborate with credible local, national, and global organizations to deliver strategic programs and events which have influenced over 93,000 women since inception. I would like to, everybody here is a distinguished guest and we're very grateful that you're here.
But I want to acknowledge two partners in particular. First of all, I'd like to acknowledge the Honourable High Commissioner, the Australian High Commissioner to Nigeria, Mr. Paul Lehman. Thank you so much, Paul, for being here. The Australian High Commissioner has been supporting WIMBIZ with the Big Sister program and with WIWIC, which is our Winning Without Compromise program that we do on university campuses. In addition, I'd like to acknowledge the presence of Darcy Zotter, who is the Public Affairs Officer for the United States Consulate here in Lagos. Darcy, good morning. Thank you for being here. Again, the United States Consulate have been very supportive of WIMBIZ. They supported our Big Sister program and WIWIC, and I'm sure a couple of other things which I can't quite remember right now, but I just wanted to use the opportunity to publicly thank you for your support. And to all our other sponsors that are here for this event, thank you so much. So, though we are a gender-specific organization, today's event and topic are gender neutral. Today's theme is spurred by the Bill Gates speech given when he visited Nigeria earlier this year. The crux of this message was that Nigeria will thrive when every Nigerian is able to thrive. If you invest in their health, education, and opportunities, then they will lay the foundation for sustained prosperity. If you don't, however, then it is very important to recognize that there will be a sharp limit on how much the country can grow, end quote. Essentially, leaders were commended for infrastructural investments, but were also charged with making investments in the people who would have to maintain these infrastructures in the long run. Until the day that AI renders the human workforce obsolete, you need people to get things done. Too often we resort to importing experts from abroad to fix the roads, build the airports, install machinery, even manage retail stores. But once it's fixed, built, and installed, who maintains it? Without a motivated, healthy, adequately nourished, skilled labor force that stays ahead of the learning curve, without employees who are fit for purpose, the impact of any investment, any policy would be limited. So, how can we create an environment that rewards ability and not inefficiencies, supports initiative and not recalcitrance? Today, we are here to look at innovative ways to invest in people. Innovative because they target the physiological needs, the safety needs, the esteem needs, and the self-actualization needs, and so on, of Nigerians. What are the innovative investments we can make and indeed must make to sustainably grow the economy? When can we start looking inwards for our solutions? How much of that responsibility lies with the individual or with organizations, and what is the role of government? How do we as business leaders, policymakers, thought leaders move Nigerians up through Maslow's hierarchy of needs? Today, we have a panel to lead this discussion, and this panel is moderated by Mrs. Catherine Bickerseth. Now, I'm going to introduce the moderator, who will then come up and introduce the panelists. After careers with Citibank and the Department of International Development, Mrs. Bickerseth founded and is the co-director of the Strategic Educational Advisory Services, or Strategic Educational Advisory Services Limited. This company holistically nurtures human capital from cradle to workforce to enable individuals to reach their full potential in diverse fields. Mrs. Bickerseth holds a BSc Economics, MSc Management Science. She's a British Council qualified educational consultant and has participated in the Harvard think tank on 21st century education and education-focused initiatives organized by the World Economic Forum. Mrs. Bickerseth is a Wimborne Fellow, the Chair of Development Africa, Advisory Board Director of Children's International School, and an Ambassador for Teach for Nigeria. Please put your hands together to welcome the moderator for the 2018 CEO Policymaker Interactive Series, Mrs. Catherine Bickerseth.
I also welcome you to this interactive series focusing on innovative investments in people. I think we all agree that given the macros of the economy, it sounds as if things are working and there's been progress in Nigeria. For example, last year we were told that officially Nigeria was no longer in recession and that GDP growth was 1.9 year on year. And indeed this year it's been estimated that it might be 2.1 year on year. Last year, the central bank said that direct foreign investment was increased by $12.2 billion, that diaspora investments or inflows totaled $22 billion. The price of oil increased, and agriculture became the poster child for Nigeria. On the social front, there was a dramatic increase in activities. We had Artex 2, we had Mo Abudu's Blockbuster, we had Fela from Terraculture, we had the GTB food fair, etc., etc. So if you're living in a bubble, it all sounds as if Nigeria is on the road to success. But it was in this very room on Saturday that I was reminded again that we have a long way to go to achieve the SDG goals of zero poverty, no hunger, quality education, and good health, and 17 partnerships. And this was brought home by two former street children. They had suffered incredible abuse and hardship that no child should suffer. They were traumatized before they were 7 years old. But today, they're graduates, and they are quality human capital contributing to the economy. They were rescued by an NGO, as I said, but that's a drop in the ocean, because when you look at statistics, right, there are 10 million, that's conservative, 10 million street children roaming the cities of Nigeria. The poverty level is incredible, 70 million and above, 70 million is conservative, 86% in Sokoto State, comes down a bit in other northern states to about 77 or 79%, and then in the south it's 59%. But anything above 10 or 20 is far too much. Poverty level being living off $1, less than $1 a day. It's too much. So, part of this panel's job is to proffer solutions strategies and solutions which will help us get closer to the SDGs that we have signed up for. So, distinguished ladies and gentlemen, it gives me great pleasure to start introducing the panel we have this morning. And I will start with Dr. Ohiri, because health is wealth, and if you don't have a healthy population, little can be done. So Dr. Kelechi Ohiri is the managing partner of Flint Atlantic, which is a Pan-African impact firm focused on health. He's also the founder of the Healthcare Leadership Academy and CEO of Healthcare Delivery and Strategic Foundation. Dr. Ohiri previously served as a senior advisor to the Minister of Health and at another time the Minister of Finance. He was the engagement manager at McKinsey & Co. for healthcare in Europe, Middle East and Africa, and a director at World Bank working on health systems in the Middle East and Africa. Dr. Ohiri has served on numerous global expert panels, including the Institute of Medicine, the CDC, World Bank, and WHO. He's currently on the WHO Alliance for Health Systems and Policy Research. Dr. Ohiri is a visiting scientist at Harvard University, a Desmond Tutu Fellow, and member of the Aspen Global Leadership Network. Dr. Ohiri has a medical degree, Masters of Public Health, MSc in Health and Policy Management. Dr. Ohiri, I'd like to welcome you to the stage. Well, once you've got health under control, obviously you need education. And so I'd like to introduce the second panelist, Mrs. Kehinde Mwani. Mrs. Mwani is the CEO founder of Meadow Hall Group, which includes Meadow Hall Education, Meadow Hall Consult, Meadow Hall Foundation, Spring Meadow Edutainment, Meadow Hall Franchise, and Meadow Hall Resources. Mrs. Mwani has received numerous awards for her contributions to education in Nigeria. For example, she was awarded Entrepreneur of Our Time by Junior Achievement Nigeria. She was awarded Fellow of the Order of Sustainable Education from Obafemi Awolowo University. She was awarded Excellence in Quality Education from Nigerian Entrepreneurs and National Outstanding Leadership Award from the National Association of Nigerian Students. Mrs. Mwani holds a law degree and a diploma in Montessori education, a PGD in education, an MSc in education, and has a doctorate in education in view. Mrs. Mwani is a certified John Maxwell coach, trainer, and speaker. Welcome, Mrs. Mwani. Okay, what do you do with health and education? You get involved in the economy. So my next guest, Mrs. Adepeju Adebajo, is the Ogun State Commissioner for Agriculture. Before she transferred to the public sector, her previous roles included MD Project Management Office and Geocycle at Lafarge Africa PLC. She was the CEO Cement for Nigeria, the MD WAPCO, MD Muka Foam Limited, MD UTC Nigeria. Mrs. Adebajo was on the board of Lafarge Africa, Ashaka Cement PLC, and on the advisory board of Lagos Business School. She supported the Federal Ministry of Budget and Planning in the development of the 2017-2020 National Economic Recovery and Growth Plan. Mrs. Adebajo holds a Bachelor and Masters of Engineering, Chemical Engineering, and an MBA. Welcome, Mrs. Adebajo. And finally, I'd like to introduce Mr. Yao Nsaku. He's the Executive VP of Unilever Ghana and Nigeria. He's also the chairman of the Diversity and Inclusion Board of Unilever Africa and represents Africa on the Unilever Global Diversity and Inclusion Board. Mr. Nsaku is an advisory member of Lagos Business School, a regular speaker on business issues, especially on leadership and marketing. He's an executive member of several trade employee associations and strategic private sector committees. He's also a director of the Changing Lives Endowment Fund. Mr. Nsaku holds a degree in chemical engineering and a PGD in management and is an associate member of the Ghana Institute of Engineers. Welcome, Mr. Nsaku. You do very little unless you're very healthy. So I'd like to kick this off by asking Dr. Ohiri to give us a little background and answer the question, what innovative health initiatives can result in improved narratives at the grassroots level? Dr. Hiri.
Thank you very much for that. Good morning, everyone. And thanks for the opportunity to speak here. It's my first time at WIMBIZ, and really impressed, and congratulations for the amazing job being done in bringing these issues to the fore. It's not going to be easy to talk about healthcare or health, which is even much broader, in 10 minutes. So I will do my best to give a synopsis, but try not to bring a reductionist approach to talking about something that is so important. And in doing that, I'll try to give both a public macro perspective briefly, but also try to bring it more home, make it more practical as to what we can do collectively as individuals to improve the narrative of healthcare in Nigeria. It was instructive what Bill Gates said, because as Catherine had mentioned earlier, there are many reasons to be optimistic about Nigeria in spite of all the issues that we face as a country. Healthcare is particularly challenging. It's particularly challenging because health is both, it's a public good, it's also a merit good. And therefore, you need many things to work together in this complex adaptive system. We've heard about how the health outcomes up in Nigeria are poor, and that is true. We know that 1 out of every 8 children will probably die before their 5th birthday, but the other side is that infant mortality in Nigeria has been reducing by about 26% year on year over the last 15 years. We also know that with regards to healthcare, where you're born and where you live and how much money you have is important. In Nigeria, for instance, we know that out-of-pocket expenditure accounts for at least 2/3 of healthcare spend, which means if you have deep pockets, you have better health. If you have no pockets, you don't get access to healthcare. And these are the facts of life. We also know that Nigeria at this point is undergoing what you call both an epidemiologic transition and a demographic transition. Epidemic transition because in many countries in the world, you go from a burden of disease that's primarily driven by infections, maternal and neonatal deaths, and as the country grows, it begins to encounter non-communicable diseases, etc. But in countries like Nigeria, we have what you call a dual burden of disease, that while we're yet to contend and deal with things like malaria, HIV/AIDS, maternal and neonatal deaths, we're having an upsurge in chronic diseases, cancers, diabetes, high blood pressure, etc. And these are not the things that our healthcare system is actually structured to actually handle at scale. So you have the fact that one of the greatest risks to the Africa Rising story, where you have an emerging middle class, is actually shocks as a result of catastrophic healthcare expenditure. And so it's imperative that we address healthcare issues. And then thirdly, with regards to the demographic dividend, I know we're in a sort of democratic process right now, elections are coming. And in order to reap what we call the demographic dividend, not the democracy dividend, we need to invest in health. And how does this work? It means that as a country evolves, there's a point in a country's life cycle or lifetime where those in the working age group outnumber those in the non-working age group. And that's called a dependency ratio. And typically, countries evolve from a pyramidal system where lots of children, because of our high fertility rates, lead to a pyramid in terms of our demographic profile. And after a while, with improvement, with reduction in infant mortality, we have a youth bulge. And hopefully, with the right investment in health and education, these people grow and become constructive members of society. And this was what accounted for a lot of the growth we found in Asia, in Thailand, etc. But Nigeria is at the cusp where if we don't invest in our youth, if we don't invest in healthcare, we'll come to a situation where instead of having that demographic dividend, you'll have a burden, which we're currently facing with youth, etc. And so making the rationale for investing in healthcare is really important. And I think this, I won't go into a lot more detail as to why, it's because I believe everyone has encountered the healthcare system personally, or you know someone who has encountered it. And sometimes it's overwhelming. But what can be done, particularly with your question, which is to actually change the narrative. It starts with the philosophical, what kind of society we want, right? Most of us here in this room have access to healthcare because we are of the socioeconomic bracket that makes it possible to afford insurance, to make informed decisions, and to exercise agency about our healthcare. That's not the same for majority of the population. So what do we need to do? The bedrock of every healthcare system is primary healthcare. And there are issues that need to be addressed both on the demand side and on the supply side. On the demand side, the biggest barriers are two things. One is, cultural and social constraints that limit access to care. And you particularly find that in other parts of the country, in the north, etc., where even a pregnant woman will need permission when she's in labor before she can access care. But the second issue we face is financial access to care, which is how do people pay out of pocket for care that is expensive? But on the supply side, what quality of care do people actually access? And that is a major issue. So some of the things that can be done practically on the demand side are, for instance, we need to expand health insurance coverage. Lagos State is doing a pretty good job in trying to introduce a scheme that expands coverage. We need to grow the market, people who can actually access care, making sure that, like in other countries, you don't incur catastrophic costs of healthcare at the point that you need it the most, when you're most vulnerable. On the other hand, we also need to look at the provision of healthcare. We have market failures that exist. So one is quality of care. What can we do to improve the quality of care that we have? We need to build primary healthcare systems that people can access. We need to ensure that standards are kept and standards are enforced. But we also need to ensure that both the public and private sector can provide those services. We have a mixed healthcare system. In a place like Lagos, about 90% of providers are private. And so relying on the public sector alone will not do that. I know I have a few more minutes to go, so I'll just wrap it up by just saying that if you are sort of thinking about what you can do as a person, there are many things that you can do. Most of us are chief executives. Our staff covered. Do we have health insurance for our staff? That's where it starts. We know the impact on productivity from accessing care and from having people actually have their care better managed. There are issues with regards to the financing mechanisms for care. So for instance, the average provider cannot access finance at current cost of capital. What can we do to improve financing for healthcare, be it intervention funds that have been done in other sectors, etc. On the other hand, most investors will tell you that it's hard to find bankable deals in healthcare. What can we do? Even from the fact of, the most hospital providers are run by sole proprietorships and clinicians who have no training or grounding in financial management. One of the things we've done is to set up a healthcare leadership academy to just fill that gap. So on the supply side, there are things we can do to partner to improve whether it's financial literacy so that we can create sustainable business models where care can be provided of good quality and that are affordable. But on the other hand, we also have to deal with the big elephant in the room, which is affordability of care and provision of health insurance coverage for people. How am I doing on time?
I think your time is
my
up.
time is up. So
Yes.
I look forward to any questions you have. And as I said earlier on, it's a very complex system. And if I have, simply oversimplified it, hopefully we'll catch up in the Q&A. Thank you.
Thank you, Dr. Ohiri. But while others are talking, please, can you think about how these initiatives can be financed? All right, so moving on, education. Mrs. Mwani, my question to you is, what reformation in education at the grassroots level can drive change which will propel Nigerians into the next economic revolution?
All right. Good morning, everybody. Good morning. I'm a school teacher. Yeah. I'm really excited to be here today, talking about my passion, which is education, and especially education at the grassroots level, which is why when Mrs. Bickersteth introduced me, you mentioned the fact that we have a foundation. After we started the school, the next thing for me was, looking into the public schools And for that reason, we started the foundation. So it's a topic that's very dear to my heart. You know, when we look at the grassroots level, I look at the children in those schools, in the public schools, you know, all over. We see them every morning. I like to tell stories a bit, because when I'm going to work in the morning, I see those young children. I'm sure you see them as well. You know, they're standing by the car in Lekki, you know, begging. Healthy children. In the afternoon sometimes, I see these children, you know, in school, those in school, in uniform, going home happily at the end of the day. And I look at myself sometimes and I think to myself, what did they learn today? What's the future for these children? How are they going to cope in this 21st century workplace? What is their future? You know, when I think of things like that, it actually makes my heart sink. And I'm so glad that, you know, today we're having a discussion like this. Of course, with those thoughts in my mind from time to time, I think of what we can do, what can be done. And of course, with the SDG goals, the SDGs as well, we don't even have a choice. We need to do something about equity in education, about quality of education. Also, we're talking about economic growth and all that. The students of today will be the workforce of tomorrow, and they are the ones that will power the economy. So it's so important to look at the education sector. I tried, you know, as much as I could, not to focus on things that we don't have any control over. So I tried to look at changes, solutions. I'm not even going to go into the challenges. We all know the challenges. But the solutions I looked at are more of things that can be done, things that don't even need that much funding. It might need a mindset change, both in the populace and the policymakers and all that, but maybe not so much of the money. I also tried to look at models, not just like Finland and all those countries where you have the support of the government, but more at the poorer areas. Malawi is an area in southern Africa. You know, it's a very poor country, but they've done a lot. They've spent a lot on improving their educational system. So I've tried to look at things that we can do. I looked at short-term strategies and long-term strategies. The short-term strategies are things that it's, you know, just quick fixes that we can do. For example, I looked at the NYSC program. Right now, the focus of the NYSC is actually national integration, you know, going from the south to the north, but it's not working. How many of us went to where we were posted to? I know a lot of, one or two hands going up there. But then, even if we did, the truth is right now with the crisis we have in education, we need teachers. The problem is availability of teachers and the quality. You know, and I'll go into the training and all that. So at the end of the day, if we can turn the NYSC program around, let it focus on education. Instead of sending them up and down, you don't even want them to go to some areas because of, you know, the issues there. Let them, you know, be taught. The orientation period, let them be taught. Let these children be taught. Let these young adults be taught, you know, how to teach. But all we need for now is that basic literacy, basic numeracy, ICT skills that anybody can teach. Like I said, these are short-term strategies. You know, proximity, you don't have to pay them too much. Let them be able to do that. It has to be monitored. We need to get educationists, maybe in the government, to monitor this program. These are little things that we can do immediately. We have the Teach for Nigeria model. I don't know if we know about it. It's modeled after the Teach for America model, where organizations go into universities, get the best brains, you know, get them to sign up for 2 years to serve their country. I feel that part of the problem is our curriculum in the universities must must begin to even address things like community, like service, civic virtues, social justice, equality. We don't teach it in schools most of the time, or when we don't focus on it. So when they graduate and all that, they're not interested in their nation. They're young, the millennials. They're thinking of how to get rich and get their money and all that. If we put that in the curriculum, you begin to see that the mindset will begin to change. So those are some things that we can do short-term. Bridge schools, we have bridge schools where they have scripted programs, use a lot of technology, and all these things are scalable. We can take it from one area to the other and help the children in the grassroots. But of course, my heart is really in the long-term strategies, because the short-term strategies have, quite a number of issues. It's just, trying to put Band-Aid on wounds, not treating the source of the problem of the disease. But the long-term things, the most important is the training. It's training. But when I'm talking about training, I'm talking about the initial teacher training to even start with. I think we need more specialized universities, education universities. The regular universities, of course, when they go to the Faculty of Education, you will do education courses, you do the subjects, and all that. But at the end of the day, the focus is not really on pedagogy. The focus is more on the subjects. But when you have the specialized universities, the focus is education, how to teach. So, we need to focus on primary education. That is why it's called primary. It's key. It's not just about the secondary and the tertiary. It's whatever you do in the foundation that will give you a solid grounding. So values must be taught. I've talked about in-service training. We have professional development. We have professional learning. They're different. Every school should become a professional learning community. It's cheaper. You are learning within your own organization. It's not expensive, Of course, incentives and welfare. You cannot, I liken that to, and I'm not likening teachers to house helps, but you have children, you love your children, but you don't take care of the people that take care of them. I think we don't need the PhD to understand that teachers have to be catered for. Our president is talking about more remuneration, being paid better than other professionals, which is the truth. But then what takes away the money? It's the taxes. So we have to look at other ways, affordable housing for them, different things that we can do, send them on, just incentives to make them want to continue. And for the younger ones to want to become teachers. I run a school. You ask them, what do you want to do in future? Nobody wants to become a teacher. What are we going to do? It's a crisis we have on our hands. And of course, public-private partnerships, in the UK we talk about the academies, and things like that, where the government, and the private owners or charitable bodies will manage government schools and things like that. Because of time, we need to get the children into school. We have the teachers, we need to get the children into school, these children out of school. How do we do that? I know the government is doing the free meals and all that, but something as simple as having those colorful, like play parks, those colorful equipment that we have in our private schools. Have you seen any in any public school? They can't be that expensive. What can we, I think we'll be talking later about what we can do. Do we talk about the funding now, the funding ideas? Okay, so I just have a few funding ideas because Catherine was very insistent that we need to look at, the other things that we can do apart from looking at the government. And in universities right now, I don't know if anybody here is from Pan-African University, but I learned that they're doing something with their cooperative. They wanted to build hostels. So what they did was to outsource the project to their cooperative in the university. So the cooperative, of course, they have money, and then I have that red. Okay, so cooperatives, all these universities can do that. They're very large cooperatives and universities. They can work on projects. My time is up. Maybe
yes,
later
thank
on.
you, Mrs. Mwani.
Thank you very much.
Thank you very much. So that brings us to Mrs. Adebajo. Mrs. Adebajo, who should be the major players in scalable initiatives which seek to increase individual wealth as well as our GDP? And how can we persuade specific players that there's a need for a paradigm shift?
Thank you very much, Catherine. When I came here, I suspected that I might be one of the few public sector or government officials. Raise your hand up. I saw Dr. Odena Jumogobia, so I know that if I get into trouble, he will rescue me, hopefully. But just show of hands, who here is serving in the public sector? Okay, very few. I rest my case. Well, I'm public-private. But I asked that question because I think, of course, the government is overall responsible for creating the enabling environment that allows us to have a healthy populace, well-educated, who have jobs. But of course, we as individuals are extremely responsible because, of course, we get the leaders that we deserve. We get the leaders that we deserve. So if I do a very poor job here, it's because you all somehow contributed to me being in the public sector, and it's your fault anyway. But President Muhammadu Buhari's plan at the inception of this administration was on three very basic pillars: security, corruption, and the economy. Now, why security? Again, very obvious. If you don't have a secure environment, then you don't have a good environment for investment. And at the end of the day, I think we're talking more about inclusive growth. Because when we talk about GDP growth, we've come from the very heady days of 6 to 8% GDP growth, which we all came to recognize was jobless growth. So if we're at 1% or 2% GDP growth now, that feels a little bit more comfortable and a little bit more real and reflective of what is actually going on in the environment. And so in 2017, the government came up with a plan. It's good to have a plan, right? We have to have a plan. So the plan to help us basically, and let me read the vision. It was a vision to restore economic growth, invest in Nigerians, that is you and me, and build a globally competitive environment. And there were 5 pillars. One was restabilizing macroeconomic growth. Number 2, agriculture and food security. Now, I'm Commissioner for Agriculture, so I'm not just talking about my favorite subject, but why agriculture? Agriculture employs over 70% of Nigerians, contributes about 24% of GDP, but only contributes about 4% to our national income. So if we're talking about inclusive growth and we're talking about jobs, you must look at the agricultural sector because that is where most of Nigerians are actually employed. So that was the second pillar of the Economic Growth and Recovery Plan. The third was energy efficiency, looking especially at power and oil and gas, again, for very obvious reasons. The fourth was looking at our transportation infrastructure, for obvious reasons. And the fifth was looking at industrialization, especially as it concerns SMEs. So I'm going to touch on just 3 aspects of that Economic Growth and Recovery Plan. The other thing I must mention, which is very, very important, is I've been most of my life in the private sector and in many, many, many change initiatives. It's very difficult to implement a change initiative in a company. Talk less of a country of 180 to 200 million people. So there was a recognition that while you're going through this structural change, you must put in place social safety nets. And thereabouts brought probably the most ambitious social investment program that we've had in the history of Nigeria. So I'll talk about 3 aspects really of the Economic Growth and Recovery Plan. Number 1, I'm not an economist by any means, so forgive all my lapses. I can see that there are many more qualified people here. I'll talk about the economy, I'll talk about agriculture, and I'll talk about the social investment plan. And so when we talk about innovation, I think there's a big room for us to have a plan that we stick with and we actually implement. Nigeria has had lots of very, very good plans. The issue is actually in implementation. So when we look at the economy, let's look at the headlines, the FX rates and interest rates. foreign exchange rates have been pretty much stable for the last year or so, so something must be kind of working there. Interest rates are coming down. T-bill rates have gone down from about 16 to 18% to 13 to 14%. And a lot of it is really looking at the debt management policies that are shifting us from more domestic debt to external debt, about 60 to 40%. That high level of domestic debt, it used to be about 80-20, we're now around 70-30, is moving us away from essentially high coupon, high interest rate instruments towards lower interest rate instruments that allows us to basically have more money to spend. So when you look at FX rates and interest rates, maybe things are kind of working. They're not where they should be, but I think there's progress. The other thing that we must be very conscious of is that we talk very much about national policies, but most Nigerians live at the state level, right? Maybe Lagos has 20 million people. What's happening to the remaining 160 million plus? They are all in states. When we're in Lagos State, I think sometimes you have a very deceptive view of what's actually happening in the rest of the country. So as you look at national policies, be very concerned about what is happening at the sub-national level. So the government has spent quite a lot of money, over 9 trillion naira, bailing out the states essentially, 24 out of 36 states who couldn't pay salaries by all sorts of, call it budget support, call it Paris Club refund, call it what you will. But it was basically to enable the states to start paying salaries. Many of the workers at state level, we're talking about inclusive growth and jobs, are working one way or another in the civil service and they need to be paid. So this is some of what's happening at the macroeconomic level. Now, agriculture, food security and national security. Again, the president made a very simple but profound statement at the launch of the ERGP. We must be able to grow what we eat and produce what we consume. It sounds so simple, but it's so fundamental. A country that doesn't have food security does not have national security. And so there have been a lot of policies at the national level aimed at providing single-digit interest rate to stimulate agriculture, providing inputs at a subsidized level. I'll have to skimp on agriculture because I see my cards are already coming up. But at the state level, I'll speak for my state, which is Ogun State, we're going through a number of substantial reforms in 5 areas. Land, because most farming starts with land, and the cost of clearing land, access to land, fragmentation of land, which means that our agriculture is very inefficient, needs to be addressed, and it is being addressed. The second is inputs. For a farmer, yields are profitability. If they don't have good seeds, if they don't have good fertilizer, if they don't have mechanization services, if they don't have extension services, their yields will always be poor. And guess what? They will be uncompetitive. You'll never be able to compete with imports, and you go back to importation. Bad old ways. So we're addressing land, we're addressing inputs, we're addressing organization of farmers, we're addressing access to mechanization services, and so many things to ensure that we can stimulate agriculture. Social investment program. While all this is happening, Nigerians need a social safety net, and there have been 4 important innovations, Catherine. The first is N-Power, which has some components, N-Agro, N-Teach. About, I think, 400,000, I forgot the number, graduates and non-graduates are now earning 30,000 naira a month. Homegrown school feeding program, my favorite. You need to go into the classrooms and see the faces of children who have had a meal. If many of us, we eat, we take for granted the fact that we eat. If we don't eat, it's because we choose not to eat. So imagine the impact that has on your health, on your education, your ability to concentrate if you've had a meal in the morning. 8.2 million children benefiting from the homegrown school feeding program. Conditional cash transfers, 5,000 naira a month to the poorest of the poor. JEEP, Government Empowerment and Enterprise Program, I think, giving loans of 50 to 350,000 naira to market women in 24 states. There I'll rest my case. How many of us in this room know who our ward chairman is? Yes, Ronke does. How many of us know who our local government chairman is? How many of us know or who has ever spoken to the person representing us in the House of Representatives? We all know our senators, of course. We are big men, so we all know our senators. On this, I rest my case. Thank you.
And last but not least, I have a question for Mr. Insako. How can the current decline in human capital be arrested, and what structures need to be put in place?
Thank you. I, of course, speak from the perspective of industry, I suppose. That's my assigned role. And while we've been asked to talk about innovative interventions, I prefer to talk about effective interventions. If they're effective, be they innovative or not, I think that where we are in terms of the face of development, that should be good enough. Now, if you've read the article by Henry Mintzberg, Managing Quietly, to try and give some conceptual context to why I take this position, Mintzberg says that if you follow the medical history, and there's someone more qualified to talk about that here than I am, in terms of all the drug breakthroughs and so on that have been made, his analysis seems to suggest that human health, in terms of the biggest advances that were made, came about when humankind found a way to purify water, drinking water. That was the biggest impact on longevity that modern science has produced for society. There's an equivalent in that when you come to development. We can get stuck in looking for very complex and innovative methods, but a lot of the time is getting the basics, the fundamentals in place. If I look at it as someone from business, my starting point always is that business's number one contribution, the most solid contribution that business can make to society, is responsible growth. If you have the factors in place where business can grow in responsible ways, in inclusive ways, you have an ecosystem beginning to add value to all the participants in it. And the key issues that we have been discussing are fallouts of a lack of broad-based prosperity, or to make it even more blunt, fallouts of a concentration of wealth and therefore major inequality. Those are the challenges of development that we are talking about. So one, in order to get businesses to grow rapidly in Nigeria, one, we must tackle the fundamental issue that business in Nigeria is faced fundamentally with the job of creating markets, not necessarily competing amongst itself for market share. We need to redefine that and say that how do we develop markets in Nigeria? If you come to my sector, that is consumer goods, look at most consumer products on sale in Nigeria. The selling price is higher than in most parts of the world. That is an outcome of systems in place that are not competitive by themselves on a standalone basis. So the number one intervention to make is how do you take the waste out of the ecosystem, the business ecology, so that you can be more competitive in terms of your offerings to people. If you make things more affordable, more people get access into markets, the markets grow, businesses grow, they pay more tax, they create more jobs. Over the last 4.5 years, at different levels of our ecosystem, we've created something like 3,000 jobs. That has come about because more volume is going through. And more volume is going through because we have been able to make our ecosystem more efficient. And therefore, while there may not be jobs that pay the salary of a CEO, sometimes we have provided means and incomes to people that have erected them into dignity. Now, a lot of what we do in terms of what we see as basic products is really giving dignity to people. In the area of nutrition, so we have an intervention in part of what we call the Unilever Sustainable Living Plan, where anemia is an endemic condition in Nigeria. So many of us, including Nestle and others who are in savory products, have put iron as a carrier in our bouillon products. Simply by doing that, you improve people's health through better nutrition. If you're able to impact on sanitation, if you look at some of the push factors that keep people from schools, one of the major elements that comes up when you go further down the socioeconomic ladder is that people do not have decent sanitation facilities. So intervening in there, first of all, giving products that are accessible so people are washing their hands when they should, but also working with people so you provide some of these facilities, mean that you keep more people in school. And I was saying to the moderator before we started, I fundamentally believe that the biggest transformer of society anywhere in the world is to create avenues for social mobility through a public education system that works. And I was giving an example. I said, I'm here. My grandfather was an illiterate. My father ended up being a university professor with multiple PhDs. It's simply because he had a chance to get into a public education system that could catapult him to the peak. I don't believe today that if he was born in the village that he was born in, he would have got where he got. And I probably would be there carrying water and you'll be having a conversation about me over here, seeing how you can rescue me. The other thing is that we need to build inclusive cultures. So what I mean by that is that you erect proper incentive systems, and that's where I believe all of us, but also the private sector, it's not easy. I'm not at all saying that it's easy. When you build a meritocracy, you focus energy and resource in places that can create value for the larger society, and you insulate the society from some of the risks that come from super concentration. What the super concentration builds oligarchies and people who are extraordinarily powerful and who can skew the development process towards things that matter to them, but not necessarily the larger society. And then you end up in a situation where we are all afraid. So the walls in Ikoyi get higher and higher, and the electric fences get more and more powerful, because the more wealthy you get, the more you fear this also the society that you are living in. That's the danger of inequality. Inclusive cultures also means giving opportunities to many people. We have had to have many conversations in trying to break through in the northern markets, for example. We had the conversations about whether the interview mechanisms that we were using were the right ones. And we have found that the more broad-based we have been in terms of our representation in Nigeria, the more we have been able to penetrate markets and to win. So I've spoken about geographical dispersion, but I mean, and I should say that over here, also making sure that you get gender balance in organizations and in places, very, very useful for representing a society. And the last point I would like to make, because it's a complex subject and I can go on, is over 4.5 years, and this is not just a Nigerian problem, I've said this in many parts of Africa where I have been, I have found in many of these sessions that we come up with extremely bright ideas, we talk a good talk, and then we all feel stimulated, but then until the next one, and we are regurgitating. So I have started to say what is even more important to me, even if I don't agree with the conclusions that are coming, is let's focus on the few things that we say are important and let's do them for a change. And stop talking and talking and talking. And that's where I would like to leave it.
Thank you very much, Yao. So your last point brings me to another question for each of you, because SDG 17 talks about partnerships. And so I ask each of you to answer the question that if you had the opportunity to partner to scale up an initiative in your area of expertise or interest, what would it be? Shall I repeat the question?
I should start? Or?
Yes, please, Yao, start.
Well, we're doing lately a lot of work in agriculture for obvious reasons. The multiplier effect on people is higher, and so we're working through all the spectrums with Songhai Center, Professor Nzamujo, very sophisticated models that he's using over there, but also in our supply chain, making sure that sustainable practices, working with smallholder farmers and so on. And where you are successful, the impact in terms of the numerical impact is very strong. So more and more, that's an area of deep interest to me and to the business.
Thank you very much. Mrs. Adebajo, who would you like to partner with to scale up a particular initiative?
Well, I think I would borrow from where you left off. In agriculture, I think the government has historically taken on a lot of responsibility. But it's clear that the government cannot do everything. And of course, we have more and more private sector interventions. So for example, when it comes to, I said earlier on that the yields of farmers, which is basically the profitability of the farmer, determines everything about whether or not they're able to earn a decent living from agriculture. And there are areas such as extension services, in other words, training the farmers to know what it is they need to do to improve their yields. Mechanization services. Nigeria has a very, very low ratio of tractors in
So
terms
who
of
would you like to partner with?
with the private sector. So the private sector is able to, there are companies now that can hire their services, hire tractors, hire bulldozers, hire people to come and work in the fields with farmers for a fee.
Thank
And
you.
the government doesn't have to be the one to provide all of those services.
Thank you very much. Mrs. Mwani, who would you like to partner with to scale up an initiative?
The first thing I'll talk about will be getting this mindset change. I need people.
Specifically?
I need people, I need the society. So I'm talking to parents, so I'm not looking at companies now. I need that mindset change going. But apart
So
from that,
parents.
the parents, we're all parents here. And we need that mindset change going on, elevating the teaching profession. But specifically, we have a Meadowhall Foundation, and we focus on teacher training, teacher professional development. We do projects and programs, and it would be lovely to
So
have
who
partners.
yes, but specifically, who would you like to partner with Meadowhall Foundation? On the spot.
Anyone, people who have education as an interest. I think it's very important to have, I really can't say any company now, but people who
Oh,
are
not necessarily
particular.
a company. It might
Yeah.
be Lagos State government. So if anybody knows
But
the
I thought we're
Commissioner for
trying
Education,
to, okay, because
know,
you
it
mentioned
might
that
be,
public, we
yes.
should try and look at the private sector, because we know that
PPs,
sometimes.
public-private partnership.
Okay, so
Thank you.
public, anybody that knows anybody in the public sector that can help us, but I'm really looking at the private sector and
Thank
people
you.
who can help us from the private sector. That's my focus right now.
Thank you very much.
Thank you.
Dr. Ohiri?
Thank you. I think three things. One is on the access to finance. I think the health sector needs to have better access to capital in order to actually spur the sector. Financial institutions, development financial institutions, as well as banks, to think of innovative ways of providing access to capital, whether it's credit, investments, loans, etc., to the health sector. The second thing is on defragmenting, the market, and largely it will be by creating new business models to provide shared services for the sector and build the necessary scale. And the third thing will really be on management capacity. What we find in the health sector is that most providers have very poor financial management capabilities. And so with the Healthcare Leadership Academy, we've been working with Lagos Business School, Cambridge, and Duke to build financial management capacities. And that's something that you have in the private sector, so an opportunity for partnership will be there. And if there's, lastly, a takeaway that we can do at an individual level as chief executives to contribute a little bit to the whole agenda, it would be to make sure that all our workers, all the people that work for us, have some form of health insurance access or coverage. I think that's a good start.
Thank you very much, Dr. Ohiri. All right, so we've heard from thought leaders, distinguished ladies and gentlemen. So I'm going to open the floor for questions and answers in a minute. But just to recap the questions that were asked of the panelists, which are questions that hopefully will lead to, as Yao said, not innovations, but efficient application of a lot of things that already exist, and which will also lead to partnerships and collaboration to drive forward the achievement of the SDGs. So I had asked Dr. Ohiri what innovative health initiatives can result in improved narratives at the grassroots level. And I think that one simple thing that he obviously said was inclusion of the less privileged, increased inclusion of the less privileged in health coverage. And one simple example he gave is starting at the domestic level. I threw back to him, think about how to finance this. So that's just a marker. Mrs. Mwani, what reformation in education at the grassroots level will help improve the people development? And she spoke about changing the national service focus and how it operates to ensure that we develop quality teachers and a change in mindset towards education. And I would add a greater federal and state allocation to the education service. Mrs. Adebajo, I asked that who should be, or who should we focus on in terms of scaling initiatives. And I think very obviously her answer was that yes, we can rely on the federal government to an extent, but we should also look at state governments. And she gave Ogun State as an example of how a state government can take larger responsibility for achieving the SDGs. And when we spoke to Yao, the question was, how can we arrest the current decline in people development in Nigeria? And his response was that we should eliminate waste so that money can be spent on developing people, giving people dignity through better education, through nutrition, and through inclusiveness. So now I open the floor to questions for any of our panelists on these issues. Ladies and gentlemen, the floor is open. Mr. Akinghube. Kindly name the panelists you would like to answer your question. Thank you.
Yinka Akinghube. Morning, ladies and gentlemen. It's, as usual, less of a question, more of a comment. And I can't resist it. If anyone watched Roman Osegali, I don't know if you did, look up the name, Google it. The multiplier effect we're looking for is education. We're not going anywhere as a country without education. I distilled education to mean the ability to make informed choices. And at the lowest level, if you can't make an informed choice, everything looks the same to you. Politicians and so on might as well take their money. You can't make any difference by just looking at them. But more importantly, what Roman said was he related the economy to education. That if the average family spends 30% of its income on trying to educate their children, they have nothing left except money to survive. And you can't drive the economy through the middle class unless you can free up their pockets. And I thought that was very important. If you're looking for a multiplier effect, everybody here has spoken, all the panelists have spoken about, more or less in different ways, about how education impacts what they're doing. And my experience listening and seeing Child Lifeline, 2 young men who were street children, and the impact education made on them. I mean, if they were sitting in this room, they'd be making a contribution, and they came from the street, from having nothing at all. So if we're talking about making an impact, about making a difference in this country, a country that spends less than 1% of its GDP on education, whereas Mali and several other countries we think are poor, are spending 4%, then we better look at education. Thank you.
Good morning. I've been listening to, my name is Lorna Johnson, and of course I'm from the US. And I've been listening to the panel, and I noticed that no one talks about technology and what we are doing today and how it's going to impact the life of youth and moving forward to be a part of this global economy. Education is important, food is important, it's a basic things that we need in order to survive or to be able to make decisions. So in terms of the education for the government person as well as the educator, how are we looking at technology, including that in training and looking forward to the future of our children and the African and the continent as a whole?
Thank you very much. Mrs. Money.
Yes, I did mention the basic skills that every child should have. I talked about numeracy, literacy, and ICT. So it's something that schools focus on and should focus on. I know in Lagos State, for example, it's something that we're taking very, very seriously. We're even going into the STEM education, we're going into the coding, so it's something that is really important, and the state actually insists that schools should include that in their curriculum. So it's something that's very essential in the 21st century. Without it, you cannot be a global citizen, and it's something that we are, schools are, even the quality assurance department of the Lagos State, check, they come to check those things in our schools.
Thank you, Mrs. Mwani. But I must add, before you go to the next speaker, that this is where a PPE would be very useful, because having said it's in policy, the practical execution is hindered by the fact that there's no electricity in the schools, there are no computers in the schools, there are no teachers who actually know how to teach coding. And so PPEs would be very useful in this area. Mrs. Adebajo.
Just a quick one. Technology is hugely important especially in cutting the costs of governance. And a few simple things like people being forced to have BVN numbers, moving away from cash transfers to electronic transfers, use of a single treasury account have really impacted the cost of governance. Secondly, because a lot of the public sector doesn't have that much vested in terms of technology, there are huge opportunities to leapfrog. And just look at the increase in mobile payments. There's so many examples. Education is being introduced in the classroom. And there are many things that are being done to ensure that since there isn't that much invested in physical infrastructure, it's easy for the government to adopt e-governance quickly.
Thank you. Another question?
Yes.
Thank you.
Thank you very much. My name is Taiwo Edele. I'm the West Africa task leader for PwC. So now talking about investment in people, there's a dimension to it that I want us to consider. And that is, and I like what my friend from Unilever said about his background. And many of us here share the same background. My parents, my entire family couldn't raise 500 naira to pay for my secondary school final exams. But the focus they had at the time was, what can we do to make this kid become a better person? Unfortunately, we now have a fundamental problem in Nigeria today that I think is peculiar to us, and that is now the mind, our belief system. Parents, even people who are educated, they're looking in the wrong places for prosperity. So you go to a pastor, you go to a babalawo, and then people are no longer investing in themselves. So they don't even read. Now, my question to you, and anybody can answer this, what do you think, or what are you doing to ensure that we help with that belief system, the mindset, so that even the little people have, they can invest it in themselves rather than wasting it? Because that's the biggest investment, I think, can impact on people and have multiplier effect. Thank you.
Good morning. Yeah, my name is Tokwe Eluyemi. I'm a director at Procter & Gamble. I don't think we can overemphasize the importance of education, and I see everyone that has stood up today is emphasizing on education. All the panelists sitting up there at some point are employers of labor, and I'd like you to touch on, and it cuts across everyone sitting there, both in the public and private sector. The issue we have in the private sector today is that a number of the graduates that we get just do not have the skills necessary for today's workforce. So what can be done to ensure that the graduates or the people that we're churning out are actually workforce ready? I've heard, from the educator and a number of other people on the panel talking about inclusivity. But what can we really do? It's one thing to say, okay, we need to improve education, but really, is the education ready for the world of today?
My name is Inia Bimbola. My question really is to Dr. Ohiri and perhaps Mrs. Nwani. We have a terrible, terrible drug issue in Nigeria right now. We've had this conversation recently around the tramadols and all the other things that are going on. And the effect on education. So we're talking about education now, and particularly from the bottom of the pyramid, where these things are really happening. And then we've now gone further to notice that it has also come to the middle class. So where the small stores around us are selling these drugs to our children, and particularly when we talk about, we can say the children in the private schools are a bit protected, but particularly in the public schools. So I would like you to touch on that, because when talking about health issues, this is a very, very key issue that is affecting even education.
Thank you. Another question? The next table.
Good morning. Panelists, ladies and gentlemen, my name is Orisha Matosan Edodo Emore, international maritime lawyer. My first question goes to Mrs. Wani. And I refer to what you talked about, Teach Nigeria project, talking about the brains that go into universities to teach. I'd like to know whether these people you're talking about are volunteers, and if not, how do you source them? And then my second question goes to Mr. Yo. When you were talking about creating market and making them accessible. And I say, how do you do this without some kind of revolution in the availability of power, as you haven't mentioned anything concerning electricity in creating markets? Thank you.
Thank you. Next question.
Yeah, thank you. My name is Funke Rabo. I just want to emphasize again the issue of the drug abuse. Say for Ogun State, because I've been around, that's part of what I work on. Say for Ogun State, I've worked with the governor concerning the youth. I think it's a real gap that needs to be addressed. Because if we don't, we'll be setting up ourselves for people who will be high-level drug abusers in government later, or at the helm of affairs. So, yeah, so we really need to work on it. And what we do is that we do films, documentaries of people who had issues with drugs, and then the consequences. Because the youth resonate with the media. And except we have support, there'll be issues. Suicide, mental health, drug abuse, we really, really need to do something about it.
Okay, thank you very much. My name is Remi Shonaya. I was Core Party's 2015 presidential candidate. Two things, please. We must know how to measure productivity. Mr. Nsako talked about Professor Nzamujo in Benin. He's a Nigerian who established the Songhai farm in Benin. Why? Because of low productivity in Nigeria. So we must learn to measure and properly reward productivity, especially in the public system. Secondly, please, we are constantly doing things apart from government. I believe that WIMBIZ is powerful enough now to be a voice demanding, putting pressure on our government. We cannot forever be allowing government to go scot-free and say, you know, we will keep doing the things for ourselves. Thank you very much.
Okay, my name is Johnson Chukwu. On the educational standards, I think the first thing we should start is we need to define the standards. And then we need to enforce the standards. I went to schools, public schools, from primary school to the university. And during my primary school and secondary school time, they were what we call inspectors. And then the inspectors were to ensure that the standards were kept. Today we have done away with inspectors. So we do not even have specific standards that are enforced, monitored. Probably what happens is that the private schools define their standards to some extent.
Thank you.
And then, but I actually wanted to talk on more important issues. Okay, it's not a question, but I'm going to highlight something. And it refers to Mr. Adebayo. The report card you gave to us about the economic well-being of this country seems to be very, very optimistic. If we look at the figures, you started by talking about jobless growth. When this government came into power, the level of unemployment was 9.5%. Today, we are dealing with 18.8%. The GDP growth rate from 2000 to 2011 was an average of 7.4%. Today, we are dealing with 1.9%. The per capita income, per capita GDP of this country was $2,600 in 2014. Now we're dealing with $1,900. Okay, the question, actually what I wanted to highlight is this. It's good we present the appropriate report card so that we do not continue with the wrong way, believing the report card is rosy. Thank you.
Thank you very much.
Hello. Natalie Ebo, I'm an associate partner at Sahel Consulting. So thank you all for your intervention. My comment and question is that education is really multifaceted, and the issues and solutions are different, right? Whether we're talking about the primary, secondary, tertiary level. I work in agriculture, so I travel a lot in rural areas, and something that breaks my heart when I go, in areas of Kano or deep into Oyo State is, seeing children not going to school because the schools are far. They don't, or when you go to the schools, it's very basic. There's nothing. So my question is whether you've seen, maybe Mrs. Nwari mentioned that other countries are doing some innovative things, interesting things. So I'll be curious to learn what can we do to address the needs of, rural education so that we don't leave those children behind, because they are a huge percentage also of the youth that we're talking about. Thank you.
We can take maybe 4 more questions.
Thank you very much. My name is Otumba Adebola Oshibogun. Of course, I serve on the board of the bank. I also was a former president of the Chartered Institute of Bankers of Nigeria. But most importantly, I'm a mother and I'm a grandmother. It is very important, and I'm addressing everybody in this room, that we need to invest in people. If you pick anybody that is close to you, maybe your worker, your gardener, you impact the person's life. And you will see the multiplier effect over the children. And I've done this over years. And I think it's something we should all resolve to do. When you invest in a life, the multiplier effect, you would see it in multiples.
Thank you.
It is very important. Thank you very much.
Thank you.
Good morning. My name is Fumi Adeyemi. I run After School Graduate Development Center. So we basically work with graduates to try and get them off the unemployment market by training them to make them employable, like someone said there, or to start a business because there are not too many jobs for them. I'm going to just reinforce 2 things that Mrs. Nwani said. One, the major problem with them is literacy, and that's a failure of the primary education. So we're now focusing a lot on teacher training. Teacher training of primary school teachers is actually where we need the most, because without that, they lack confidence and it just affects so many other things. And then I'll use an example of Lagos State. We worked with Lagos State for a number of years. And one of the years, we had an interactive session with the governor. And he said, look, we always put about 2,000, 3,000 graduates in a room together with him. And he said to them one day, look, I have a problem in my educational system. I think pass rate for WAEC was about 12%. That's 5 credits with math and English.
I'm sorry, please repeat the question.
Okay.
Because this room is going to be used after this event.
Okay, so I just wanted to say, at that forum, he offered some of them employment as teachers, graduates of single honors degrees. About 500 people put their names down. The state then did a teaching methodology course, and they employed them into the system. 2 years after the same forum, their WAEC results had become 49%. So truly, we have a lot of young graduates who are looking for work, that we can solve their unemployment issues by training them and then giving them incentives to be teachers.
Thank you.
It's just a very quick question. My name is Moji Adegbile. I work with Mrs. Adebajo in Ogun State. I'm starting out in my career. I'm not a very wealthy person, but I've always been of the opinion that the best way to change from an educational level is look at yourself privately, because the government can only do so much. We're stretched very, very thin. There are many things that have to be changed. So I guess it's actually a question for that everybody can answer. Mrs. Nwani, you have a private school, and obviously you're making a profit because you're able to set up all these other businesses. Don't you think it'll be a good idea to have slots dedicated to people, to students from poorer communities? I know where Meadowhall is. There are lots of shacks there. Why don't you pick out children, because it's at a primary level where you can still make change, where you have slots really allocated for these children. So they're also growing up with children from wealthier backgrounds. They can become more vocal. They become, and then also from Unilever perspective, scholarships. Is there a possibility for scholarships again for these young children so they can also climb the social mobility ladder?
Thank you very much. We have to pause with the questions at this point in time because of time. And so I would like to give the panelists an opportunity to... Oh, sorry.
Well, just a really quick question, and anybody can answer it, but I think in particular, yeah, we're still talking. How do we implement? That's always been the problem. We've had plans, we've had procedures, we have all sorts of things. What is it that in each of your areas is implementable, and how can it be implemented, and how can we make that a habit? That's a question.
Thank you very much. So we really have to pause here. So running through them in order in which they were asked, what can be done about the quality of graduates who we deem not fit for purpose at this point in time? I know part of this question was answered by the lady, sorry, I don't recall your name, on the left. She said she has a program that actually takes graduates through a refinement process. How do we scale up? How do we have more centers? Who is interested in partnering with, what's your name, please? Fumi, exactly. Look for partners to scale up, not only in Lagos State, but outside of the state. It's very necessary. Also, I think that in terms of in the institutions, there should be this refinement or this finishing school process. It should go on in every institution. I'm sure that if you look in your companies, you do that anyway. I'm sure that lawyers that started out in your firm, for example, are not the same as when they first started. Isn't that true? So I think it's an ongoing process. But to scale up, we need centers that do that. The drug issue and the effect on education and indeed on the workforce. Mrs. Mwani, could you please speak to that very briefly?
Okay. The drug issue, I actually feel he should actually talk about. But having said that, in schools, what are we doing? Again, it's a lot of awareness. Talking to the children. You know, we're proactive in things like that. You just, like, for example, suicide is something that's a big deal right now. So we talk about mental health. With drug use and all that, and the drug problem, it's tackling the problem before they... So we have what we call the PSHE time, the time that you talk to the children about their physical, social, emotional well-being and health, and you use such opportunities to talk to them about these things that can become problems later on.
But I do know that you've been doing this ever since your school started.
Yes.
And yes, the drug problem has arisen in an amazing dimension right
Yes.
now, and the suicide.
Right.
So what different, how are you going to do things differently?
The very first thing I've said is talking, it's awareness with the children. Parents, we cannot do anything. So when you keep asking me I keep talking about mindset change, we need the parents. Children, talking to the children, talking to the parents, parents helping to also talk to the children. A lot of monitoring in schools, by schools and parents as well. We need to be aware of our children. We need to know our children, so things like that, But, okay.
Sorry to cut you short, but because of time. Somebody asked about the process for recruitment of Teach for Nigeria fellows.
Yes.
Because it was proffered as one of the solutions to providing quality teachers across the country. And I know personally that the process doesn't only involve technical assessment, but it involves assessment of soft skills. So, for example, how do people cope with nothing? How do they become productive when they have nothing? So I mentioned earlier that there are many classrooms that do not have electricity, they don't have computers. So how do these fellows propose to teach ICT in such a classroom? What materials do they use what materials do they use from the local environment to teach ICT? Or how do they empathize with students who come from broken homes and have been abused like the street children? That's part of the teaching process of Teach for Nigeria Fellows before they actually reach classrooms, so they can get the best out of the less privileged children. They can be productive teachers who can show other teachers in the institutions that they work in that this is how to get students to be productive, this is how to treat students, this is how to promote mental health in the less privileged. So we can talk more about that later. We need to move on to the next question, which was, how do you create a market when there's no power, when there's no electricity? Yeah, that's for you.
I think she identifies a constraint that is by no means one that can be wished away, but the important thing is that the variables of market creation are not only constrained to power. For example, distribution is a lever of market creation. If you take many agricultural supply chains, for example, we're losing about 40% of the produce. If you can reduce that even to 30 or to 20, there's a significant amount of saving in there that you plow back, and which therefore you can price at a level that makes people more able to access it. So the point I'm making is every incremental step that enables you to increase market access gives you an opportunity to create more jobs, to empower people economically. And I would wish that we take it in that sort of way. It is true that power is a major constraint, but I don't make the assumption into the long term that power endemically has to be short in Nigeria. That has to be dealt with in other sectors. But as of today, there are still many things that can be done to intervene in order to be able to grow markets, and let's start with those.
Thank you very much. Yeah, don't go away. The next question is, how do you measure and reward productivity?
Michael, okay. My favorite question. For me, productivity is how well you do the things that matter to you. So whichever group that you're a part of, whatever organization, first identify the things that you consider to be on the economic pyramid. And then let's just really simply say, how well are we doing it? And keep coming back and make the right benchmarks. I don't try to make it more complex than that, because you can tell yourself that you are progressing, but maybe your progress is not important, because you have to look at how well other people are doing it. The world is a competitive reality. So in whatever situation you find yourself, what are the key deliverables? How do you measure them? And measure them religiously rather than just keep talking about them. And then you find it has the right impact on you.
There are actually. I think it's a lot better than it used to be. In the past, we had people coming around, but to be honest, one would doubt their expertise and their knowledge. But recently, at least in Lagos State, we have the Quality Assurance Department, and they are doing a great job. They're doing a great job. They know their onions, and they actually come checking, and they will actually be able to certify your school as having good quality or not.
So to scale this up, other states should take a leaf from Lagos.
I think it's important.
Lagos State? The next question was, somebody mentioned scholarships. Mrs. Mwani, can you please speak to that broadly?
Right. Okay, yes. The lady mentioned of the companies. Actually, Meadowhall Group is an education group. So everything we do is geared towards education and catering to the different aspects of education of children, educating children. So we look at the talent areas, we look at the cognitive, we have a foundation to cater for the needs of the children in the grassroots. Now, scholarships, yes, we do offer scholarships. But first of all, we have a school adoption program. So we've adopted a school that we do most Okay, other people also do things with them, but then we're able to help them, especially in the area of teacher training, and also provide some infrastructure, you know, to some of their infrastructural needs. So we do that. We also partner with other NGOs to get children who need scholarship. So we have had children pass through our school on full scholarship, given full scholarship. Madam, can you? So that's what we're doing, you know. So it's not, first of all, the companies are all education focused to cater to the needs of different children. Yes, you want to say something?
Maybe it seems very basic, but just something as simple as plucking a child from a community, because
That's-
you raise one child and putting him amongst your own.
Right, that's what I'm saying.
So not necessarily. Not
In-
necessarily looking at a school in the village
Right.
and supporting them through infrastructure, etc.
Yes.
Literally taking the
Yes.
child from the village,
Yes.
putting him amongst your students, and then he will now later go back and alleviate his own community.
Yes, we've done that in the past, and we've worked with Bethesda, you know, to do that, where we got children from, you know, the poorer areas in Lagos, and they came to our school all through the college. We were able to do that.
And this happens in other
And
institutions.
on so many other private schools as well. We do that, yes.
There was a question here about, okay, we've all talked and we've expressed opinions on what can be done. Is the implementation. So, Dr. Ohiri, you had some great ideas about improving health outcomes. So, how do you propose to get implemented? Specifics, please.
Well, that's permit me, I just want to make a comment on the mental health issue and substance abuse, and then we'll try to address this. I think it's really a very important issue that you raised, and one can look at the whole issue around drug abuse from a supply and a demand side. On the demand, yes, people they need these drugs for something, there's a physiological dependence, but what are the underlying causes? Why are they looking for these drugs? And part of it is because there are lots of mental health issues in our communities that are not addressed because of the way we stigmatize mental health partly, but also because there are other stressors and we don't catch people early enough. So interventions need to be put in place. One, to destigmatize mental health, also to talk to people who are at risk, whether it's youth or in schools, and there are many forums for that. There's also something on the supply side, which is where regulation, because they are not abusing, you know, drugs. It's not cocaine. I mean, people abuse all sorts of illicit drugs, but they're also abusing drugs that you can purchase over the counter. So there's something around regulation that I guess the Ministry of Health has actually stepped in to do something about it. But it's a fundamental issue. It's not new. Sadly, it's something that has been going on for a really long time. And we do not do ourselves justice by continuously criminalizing it because we're sending it underground. So we need to make sure that there's a forum to actually address this without the criminalization and the stigmatization that makes it even more complicated to address. And if we don't do that now, yes, it's going to get worse. Now, in terms of very practical things, yes, I'm a firm believer in, you know, getting things done. And yes, we do talk a lot about stuff. From the health sector's perspective, you know, they say, how do you eat an elephant, right? You start, you know, one piece at a time. So at the individual level, there are things we can do. At the corporate level, there are things we can do. And then at the systems level, there are things we can influence. Individually, we've spoken about what do we do in terms of where our own personal decisions for our health, what we want to partner with, where we want to put our monies. I hope we're all insured somehow. We all have health care coverage. And our staff today. Yeah.
Are we all covered? Do we all have health insurance in this room? Please, could you raise your hand if you do? I would say that's 50% of the room, if we're being honest. I think all of us need to. And secondly, how many of us have insurance, health insurance for our staff and our domestics? Could we please show hands? Start with our domestics. We have health insurance for our domestics. So if you don't, this is a call to yourself, your domestics, and all your staff. Please, Dr. Hiro.
Thank you for that. I think it's really important because we begin to realize and see the value, and then we go forward with that. Thirdly, on the issue of access to finance, not so radical idea would be, and I don't know how many of us work in the pension industry here at the PFA. We know that in healthcare, in the last, say, 10 years of one's life, that's where you incur like almost 80% of any healthcare expenditure you're going to incur. There's no reason why, as part of our social safety net system, it should not be expanded to include healthcare. So why can't elderly people's health insurance premiums be paid for out of their pension fund contributions? That's a very practical thing we can do, because both contributory and non-contributory social safety nets should be integrated to do that. So if you're in that sector, that's something you can do. But lastly, I know, Deshandra, in terms of what you can do practically, there are skill sets that are present in the private sector that are useful for the health sector. Everything we know about quality improvements in the health sector was imported from the aviation sector. So the whole thing about using checklists, about realizing that the systems that fail, and that to err is human, as published by Digital Medicine, show that you need to create a system that is fail-safe. Likewise, with supply chain management, with creating business models that integrate with experience from consumer goods in terms of customer orientation, there are a lot of things that the health sector can borrow. And the Healthcare Leadership Academy that I founded, or that is run by other people, does that very well. So there's an opportunity there to build capacity, to train, and to bring some of the best practices in the private sector that are successful to bear in the health sector, so we can create and shape the kind of healthcare system that we want. And these things are integrated.
Thank you very much. I hear that we have time for 3 more questions. On the left side this time, please. Who has the mic? So maybe one from each table on the left, please.
Good morning. My name is Orly Dawson. I'm a physician and I work in the public health space. So I wanted to talk about the fact that we have all laid appropriately a lot of emphasis on education. But it's not enough, because the children who can get educated, actually, they receive that capacity between the time their mother conceived them and their second birthday. So there's a critical interaction between health, education, and nutrition. Now, education, when we think about it in terms of mothers and children, women having babies, is really around educating for nutritional outcomes. And I think that formal education, unfortunately, in Nigeria does not confer that opportunity upon us. And so it is within the space of the health system that we need to be thinking about that. Addressing issues of teenage pregnancy, because teenage pregnant mothers are the ones who are more likely to have babies who are less likely to be able to do well. So when we talk about educable, not educable, about people who can go to university, think about the words you get who it takes 6 sets of instructions for them to actually get what you're saying. It's not enough to put a child in school. That child's brain needs to have been prepared in order for that child's brain to achieve. So I just wanted to make that point, to integrate those 3 things. Thank you.
A question on the left side this time, please.
Good morning.
Yes.
My name is Chima Ayazo. I'm into hospitality and oil and gas. Still on the education issues, like someone said, education cannot be overemphasized. But my question is, what are we as CEOs and organizations doing to support these less privileged people, like our educationists say, to be able to get education and affordable education? Sorry, let me say, I built a school in my community about 10 years ago, a nursery school, and then as we start to grow from nursery 1 to 3, I saw the need to build a primary school, and then I built the primary school. Today, the school is over 10 years old, and we've graduated our first and second set of primary 6, and it's completely free. From 22 students, I have over 500 students today. Now, I'm speaking from experience, because I know this is not cheap. A lot of churches. Sorry, let me just ask my question now. A lot of churches have universities that their members cannot afford. What are we doing about this situation?
Thank you.
Good morning. Good morning. My name is Abiola Bolariwa. I liked what Mrs. Nwana said about NYSC. We have a ready pool of graduates that we can use to educate during the program in the rural areas or even generally. So my question is, how can we take those students, and we've all agreed that they don't come out as well as they ought to, but how can we take what we have and use them to educate the younger ones during the NYSC program?
Thank you.
My name is Funke Adekoya. I'm a lawyer. My question is for the State Commissioner for Agri. Someone told me yesterday how they went to pitch an app to a government agency that would reduce processing time from 8 days to 1 day and would do away with 9 staff. And the government official said, government has an obligation to employ. Are you asking me to sack 8 people? Has the state government considered moving some of its employees into agriculture by putting them on farm settlements with the intention that after a couple of years they will own the land, since government owns the land, and will own the business?
Thank you very much. There's a question in the middle. Yes.
Thank you. As mentioned before, I'm Darcy Zotter. I'm the Public Affairs Officer, and I have one observation and one question. I've been here for about 2 years, and as some of you know, my office gives out a fair number of grants. In my present position, I have probably met with over 500 NGOs with proposals. So my first observation is the answers are here. You have the answers. My second observation, as I consider myself an activist, is that when you leave here today, decide one thing, that you're going to get in touch with one group that you support. If you don't have the expertise, give them the money. But don't make up an excuse. For myself, my own personal thing is sickle cell, and I'm getting involved. And my question is, I would look at all of you and ask you to provide the audience, including myself, who do we contact? That's been my observation in Nigeria. Nigerians are very willing to volunteer, but they just don't have the information. So if you would provide the audience with to whom, how do we contact people?
Thank you. I think we have to stop there because of time. So
I have the microphone, and I'm standing.
Okay.
Good morning. My name is, yes, and a very quick one. My name is Mary Akoboma. Again, on the issue of education, but a different kind of education. I look around this room and I know that most of us, if not 90%, grew up at a time when universities and technical colleges used to rank pari passu. I know that every time these days when we talk about education, we're talking about the formal, normal, what we know as education is that sort of education. But I could identify with what Mrs. Nwani talked about, little children on the roads these days. As we're coming here this morning, I was telling my friend in the car, say we're just reading a number of armed robbers on this road. Those kids could well go and become carpenters, metal works and all of that. My question, how do we WIMBIs, catalyze, advocate, push for the return of technical colleges? Not all of us must go to normal formal.
Thank you. Okay, thank you very much. So, answers to questions. Mrs. Adebajo, could you please answer the question about government employment agenda?
I'll answer 3 questions. The first is, in terms of vocational education, extremely important and recognized by the government, and Ogun State government at least, because we have a large number of industries in the state, and we recognize that our workforce is not necessarily ready for employment. There's partnership with those industries to identify the skills that are required and to set up vocational schools to ensure that those people coming out of, people don't have to go to university University College, and secondly, the vocational schools being set up in partnership with industry to ensure that they have the right skills. On civil servants, again...
Excuse me, Darcy asked, who do they get in touch with if they're interested in collaborating with such an initiative?
Okay, we have a one-stop shop. It's I can give you the email address, but we have a one-stop shop, which is basically the filter for all of the inquiries regarding the state. It's a one-stop shop.
So we Google one-stop shop.
Yeah, Ogun State one-stop shop, yeah. Okay, so with civil servants, again, this is not an idea that's unique to Ogun State, but certainly agriculture is actually the only profession that civil servants are legally allowed to do. Certainly there's a big case for civil service reform, putting in place a merit-driven environment, etc. All of the things that go along with that, recruitment, performance appraisal, that's all being implemented. At the same time, in our state, civil servants are encouraged and actually being given allocation for land. And that means that they can go into agriculture and they have something to retire into, especially if there comes a time when there would need to be some sort of restructuring of the workforce. Last point is the gentleman that talked about a favorable report card. The good thing is that when we talk about statistics, we can all spew out our favorite statistics. Statistics shouldn't be taken in isolation, they must always be taken in context, in terms of what was the prevailing situation when this particular score was recorded and what's the situation now. The wonderful thing is that I'm sure we all have voters' cards. It's the reason why I went to the trouble of explaining what the ERGP was, which is the government's plan against which there are targets. So you all have the power to exercise your right to choose and your right to vote by first of all understanding the structure of the public sector and how it works, because there's no point in all us amassing under Falomo Bridge if we don't understand actually how to use our power. And when it comes to 2019, use your vote and exercise your right to choose the leaders you deserve.
Thank you very much. Mr. Sambo, I'd like you to comment on vocational training very quickly. How does that impact your industry or industry generally, and how can it be scaled up?
Absolutely impacts our industry, so I don't think it can be emphasized more. The building blocks of an industrial base of any country have vocational origin, so absolutely impacts. I think the private sector can do more, but cannot do all. So the private sector obviously can set up institutions, give opportunities to interns and people, recent graduates, etc., to bridge the gap between cognitive and practical experience. We should obviously do more of that. Since it's the last time I may hold the mic, Maima had asked me about what should we do to implement more. I want to put a bit of a challenge to WIMBIZ. Now, it's all well and good for upper middle class people to come together and brainstorm these things and so on and so forth. The biggest agent of transformation in any society is the government, is the state. I know no people that have achieved development without a competent state. And therefore, it's important that all of us get the skills and the will to engage with the people who are able to make this sort of change. And then we add what we can call icing to the cake. But to think that we can completely ignore it and then somehow take society into prosperity, I think is wishful thinking.
Thank you very much. Mrs. Mwani would like to speak to vocational education very briefly.
Yes, private vocational schools and all can be very expensive, but it's a good thing to have, yes. But I think another solution we've thought about is the ones run by the federal government. You know, if we can find a way of linking, because even the society, again, they look down on those vocations. They don't, you know, the technical schools, they don't, or the parents want the children all to be, just to have the qualifications to go to the university. So what we've thought about is if there could be a link between these vocational schools and technical schools, that after doing the, you know, the learning the trade and all that, if they can, you know, find a way of aligning the universities so they can, maybe after 2 years of that, they get some credit and then pass through, even if it's the last year of university in a way, and get certified. Once they have that qualification in Nigeria, it becomes something that everybody's interested in. So if you can link the two, the vocational schools with tertiary institutions somehow, I think it will help.
Thank you very much.
Yes.
think at the end of the day, we have tried to touch on some extremely fundamental issues and things that we need to do to move Nigeria forward. There's a fundamental philosophy in Nigeria where that is cross-cutting, right, and which is really the place of merit in everything that we do. Whether it's in, and I think that comes from education, comes from expectations we have of government and civil servants. It has to do with industry and the type of society we want to create, whether we want to create more oligopolies or whether we want a more inclusive form of growth. And definitely within the health sector, we have the whole issue around equity. So my last point will really be that even as we focus on what we can do individually, and I think I've given a lot of examples to that, I think we should also think about society at large and think of a more inclusive way of actually doing better in our sector. And I think that would be my challenge and that would be my encouragement.
Thank you very much, Dr. Ohiri. So I think in conclusion, what we're all saying is that in terms of innovative investments in people, we don't have to innovate. I take my cue from Yao. We just have to look around at what exists and make sure that we implement it efficiently. And it starts with us as individuals doing what we can do in our spheres of influence. For example, the healthcare issue, take care of yourself, take care of your staff, take care of your domestics to make sure you're all covered. Secondly, what can we do in terms of scalability? We must make sure that we engage in partnerships with the right people who have the same passions and who are interested in developing the same talents as we are. And we must make sure that we think about the financing in a creative way. Don't let financing stop the execution of the vision, because there's lots of financing out there. We have to look for it. I mean, trust me, there really is. If you have a compelling story, you can find the finance. For example, Darcy said that she has money, and she's not the only one. No, I don't mean personally, but Darcy, you understand what I'm saying. Willing to consider efficient interventions that are scalable. And so I leave you with this call: multiply selflessly. Make sure that whatever you're doing, you try and scale it up to whatever level that you can, and also do it selflessly. It's not about you. It's about the less privileged people. It's about the economy. It's about the country. Because at the end of the day, we want to eliminate or avoid developing armed robbers alongside the wealth that we're creating at the macro level. So ladies and gentlemen, we couldn't cover everything. We may have not answered your specific question, but I hope that you're going away with some food for thought and purpose. Darcy said, think about what you want to focus on and go out there and do it. Thank you very much.
Good morning, everyone. Good morning, everyone. Okay, my name is Elsie Apabiu, and I have a quick information for all of us. A link has been sent to all of our emails, so if we can quickly bring out our phones and go through this link and give us feedback about this program. At Greenpeace, we're very particular about feedback for programs such as this sort of programs. This is the only way we get to improve the content and quality for subsequent years. So we'd appreciate your feedback towards this very inspiring session we just had. We want you to fill this form so that we can improve for subsequent years. Thank you so much. It will not take too much of your time. The next 10 minutes is dedicated to us filling this feedback. Thank you so much, as you will. Somebody just testified that she did it in just 2 minutes, so please bring out your phones and give us this feedback. Thank you so much.
Ladies and gentlemen, good morning once again. Thank you. I've certainly found the conversation this morning very enlightening, and personally I think I'm going away with something you said a few minutes ago, multiply myself, and I'm hoping each and every one of us would leave here with a plan to do something, get involved. There are a few people doing things in the room, and I think we can all get together, get involved with one thing, and it will make a difference. So on behalf of the Board of Trustees, Executive Council members, of Women in Management, Business and Public Service, WIMBIS, I express our sincere gratitude to the many people and organizations that have contributed in one way or another to the success of this series. I thank our distinguished speakers, Dr. Ohiri, Mrs. Nwani, Mrs. Adebajo, Mr. Osako, for the very insightful and thought-provoking contributions, which I believe has motivated us. I also thank Mrs. Bickersketh for a great job at moderating. Thank you. Thank you. We're also deeply appreciative of and grateful to our sponsors who have been very generous and supportive in spite of the challenging economic times. Eternal PLC, Lekki Gardens, System Specs, Capital and Country, and FSDH. Thank you. We're also very fortunate, as always, to have our media partners, and I thank them for their continuous support. Guardian Newspaper, Arise TV, News Agency of Nigeria, NTA, This Day, Silverbird TV, Punch Newspaper, Beat FM, Classic FM, CT FM, and Eureka Moments. The WIMBIS Board of Trustees, as always, continues to be a solid pillar of support, and we're indebted to each member of the board for their valuable contributions to our activities and initiatives. Thank you. I also express our appreciation to the members of the Executive Council for their tireless work for WIMBIS. I say a big and heartfelt thank you to the organizing committee. I'll just call them out because they've done a lot of work. Folake Adama, Kemi Adewale, Ibiwumi Akinola, Ayaba Ayo Joseph, Natalie Ebo, Olamidotun Botu Obaga, and Hansatu Adebite. Thank you for your generous contribution of time and resources. It takes a lot of time to plan this event. And putting this event together. But finally, not the least, I express our appreciation and recognition of the hard work by the WIMBIS Secretariat for all the behind-the-scenes work that we do. Thank you. Ladies and gentlemen, we especially thank each and every one of you for starting your day very early with us today. Thank you. And driving today's success. Do enjoy the rest of your day, get involved, and we look forward to seeing you next year. Thank you.